So hey everyone, uh, handsome Dr. Joe over here. I am New Jersey's first and only neck and upper back soft tissue specialist, and I work with Dr. Chris at Barefoot Rehab Rehabilitation Clinic in Denville, New Jersey. We're going to be discussing a patient I have right now. His name is Tom. Tom is a 37-year-old male who in 2016 was in a pretty bad car accident and was T-boned. Since that time, Tom's been having pain bilaterally at C5 through C7. He's also had pain into his thumb, index, and middle fingers and into his palm. Occasionally, though, he gets tingling in both hands along his ring and pinky finger. So the quality of his symptoms are sharp, stabbing, and achy, and he's getting numbness, obviously numbness, pins, and needles. The intensity that Tom is experiencing is at its complete worst. It's a 10 out of 10. He has complete impairment of all the activities, so he really can't do much. He says once the pain gets to that level, he has to lay down in his room, and he can't do anything. Again, Tom's 37, and he has a young child at home, so this pain is really debilitating and dictating what he can do in his life. He's also currently on permanent disability. At its best, his pain is at a 3. The only things that really help, like I mentioned, are prescription medication and him in a reclining position. Besides all activities, again, an example for that would be like playing with his daughter for 10 minutes, getting in and out of his car, even showering, or standing, driving for more than 10 minutes. It really provokes the neck pain, and then he gets the neck pain and starts to travel down his arms. So Tom had an MRI in January 2017, and the major finding on that MRI was he had a C5, C6 moderate posterior disc, meaning that the disc is pushing would be irritating the nerve, but that nerve distribution would only be over his shoulder and maybe some of his fingers a little bit, right? You might have pushed down a little bit. At C6, C7, I'm sorry, C5, C6 disc is going to affect the C6 nerve root, which is going to be his thumb, index, and middle finger. His pinky and ring finger at the pinky index finger would have been affected by the C6, C7 nerve root, and that's not indicative of anything on his MRI, along with the middle finger. So about August of 2018.
So remind me, what was your diagnosis for when you did the exam?
My initial diagnosis for Tom was a C6 nerve root at scalenes and a C7 nerve root at scalenes because of the pain distribution that he was having. So anything into the hand would be C6, C7, and maybe even a C8 nerve root, because that would explain the medial part of the hand.
And that was feeling for adhesion between the nerve root and the scalenes?
That was the diagnosis prior to putting my hands on him. So based off of his history and exam findings, that was my diagnosis going in.
But it was adhesion. You said nerve root at scalenes, and most people probably wouldn't know what nerve root at scalenes mean. So you mean
yeah.
adhesion.
Yes, adhesion. Yeah. He has some form of adhesion built up since 2016 at those levels. Okay. In August 2018, Tom underwent a cervical discography, which is a surgical procedure where under anesthesia, mild anesthesia to numb the injection site, but they inject the needle into the discs, and when doing that, they insert a dye into the disc. So this dye is adding more pressure into the disc, and then they also X-ray the disc to see the disc. And that is graded also on the amount of pain that he has from the dye going into the disc itself. But for some reason, the performing surgeon and his neurologist only recommended they do level C3 to C6. So at the level C3, C4, he had 0 to +1 pain. It's graded +1, 2, +2, +3. At C4, C5, he had a +2 pain, and at C5, C6, he had a +3 pain. And he said that pain at the C5, C6 level was a 10 out of 10, some of the most unbearable pain he ever got. So based off of those findings, his surgeon said, well, you need to have surgery now. When Tom came to the office, and I was explaining to him how the medial part of your hand is innervated by nerve roots at lower levels, he's like, why didn't my surgeon test lower levels? He was at, they just stopped at the C5, C6 level. My thinking is because the MRI at the C6, C7 level was clean at about a year ago, that they didn't find it necessary to do another level. But given that Tom has had this type of serious discomfort for over a year, why not do one level lower? So Tom has been seen 3 times in our office. The first treatment, he felt a little bit sore, but some relief. He came in today, actually, and he said after his second visit, he had, it doesn't sound like a lot, but he said he woke up the following morning, which was yesterday, Wednesday, and he had 8 hours of 0 out of 10 pain. And 8 hours might not sound like a lot, but for somebody who's been in chronic pain since 2016, 8 hours was really, it was mind-blowing for him. He was just like, he's like, you don't understand. Like, I woke up and I had 0 pain, and I ate breakfast, and then the pain slowly crept back. But for those 8 hours, he was absolutely pain-free. So I recommended, and then the more we were discussing, Tom and I, about what he needs to do, because he wants to hold off having spinal surgery, because that's, once you go down that road, it's a pretty slippery slope, and the results are a mixed bag, to say the least. He asked me to write him up a report, basically, with our findings, explaining to his surgeon why I believe that he should either have a more current MRI, to at least see those levels. Maybe there was more deterioration or more injury at that level that was initially found on the MRI. And 2, if before Tom has the surgery, they should do another discography at the C6, C7, and the C7, T1 levels. And then based off of the diagnostic findings from those 2 tests, I think that he can make the best educated choice on whether he wants to proceed with having surgery or not.
Yeah. So it sounds like, excuse me, that removing adhesion over 2 treatments so far is giving him at least some relief that he wasn't expecting, which is awesome. Because when you have 10 out of 10 pain most of the time, when you have that type of relief, people, I'll take what I can get. And Absolutely. It's possible, as more adhesions being removed, that 10-hour window will start to stretch to longer periods of time as his range of motion improves. So that's awesome, Dr. Joe. And the other thing is, as far as the discography, that's what it's called? Yeah. So my thoughts and questions are, as far as, is the surgeon, would he be going after the disc symptoms that he potentially feels in his neck? Or is he going after the nerve symptoms, which is potentially coming from a different disc? And what is the plan in regards to what happens if Tom decides to go that route?
Right.
So, because once you get operated on, like you said, we have to know what the plan is and which one is he going after, and is Tom clear about the expectations about that surgery? And we need to know which symptoms are correlated with which disc, and that will allow him the greatest possibility of success in having relief and getting back to his life and not being on permanent disability.
Right. So when we were talking today, since coming in and me explaining to him how the different levels of the spine innervate different parts of your hand, he started doing some of his own research, and he was actually really angry that he went through that procedure and nobody ever mentioned to him that his ring and pinky finger are innervated by a different spinal level than what they wanted to do surgery on. So he's just like, if anything, you bought me time to have more exams in the short term to figure for them to answer to me why they would do this, and I still have ring and pinky finger discomfort. So I'm assuming he didn't flat out say, because I don't think he knows, but they would probably be going after the C5 C6 disc, because that's the one that
Which is
showed up
the
on the
C6
C6
nerve
nerve root,
distribution, which
the
would be the
nerve root,
thumb and index finger.
thumb and index.
And
But
he's feeling
he
thumb.
has middle, ring, and pinky as well.
So C7, C8.
7 and C8, right?
Yeah, which is different than these two.
Which is right.
Yeah.
So even if they were able to have a successful surgery, what about this part of his hand? What about right? So so he's really happy with just on the third treatment that he was able to sustain some level of relief. It wasn't permanent, but it was a window that he was just like,
Right.
wow, I feel like this right now, you know?
Right. Yeah, and it is possible if that disc up higher is so overloaded that he can be getting some compensatory changes that are affecting those nerve distributions. But I think what you did that's awesome is it allows Tom to at least have the conversation with his surgeon and say, that's not the same nerve root as that disc. So do you expect, as the surgeon who specializes in this, that it's going to get me better? And at least he can say, okay, well, let me think twice about it. Or, you know what, I do expect those nerve symptoms to get better because those are compensating for this more irritated disc.
Right.
So, and that alone is valuable to talk about. What do I expect from this surgery if Tom decides to go that route?
Right.
It's awesome, man.
Yeah. It's he was really and it felt good, you know, to let him have those couple hours of just nothing. And it doesn't, again, he's like, it's not going to sound like much to you, but for him it was a really big deal, you know. And so it was really, really awesome stuff, powerful stuff.
I mean, that's why we specialize in people who've had pain more than 6 months and failed by 3 other doctors. Is we could be a normal chiropractor like everybody else around us, which is fine. I'm not saying there's anything wrong with that, but we're really seeking to make people's lives better. So I'm happy to hear that he felt better and that you feel good for having given him that relief. And we get to do the same thing every day.
Yeah. Yeah.
Awesome, brother. Good job.
Awesome, man. Absolutely. So if anybody had chronic neck pain for longer than 6 months and has not sustained the permanent relief that they're seeking, send us a DM or call our office, and we'll be more than happy to get a conversation going with you and see if we'd be able to help.
Awesome.
Awesome.
Good stuff, Handsome Dr. Joe.
All right.
I will talk to you soon.
Sounds good, buddy.
See you, brother.
Have a good evening.
Bye.